episode of Figuring Out Fertility. It is Canadian Fertility Awareness Week 2023, and we are bringing you this expert series to ensure that you have information and education to make more educated decisions about your reproductive health. I am here today with a good friend of mine, Stephanie Curran, all the way from Victoria, British Columbia. She is with Elements of Health Fertility Center and Mindfulness for Fertility. And today we're going to dive into, Steph, one of your programs that deals with mindfulness, and we're going to talk about mindfulness on your fertility journey. So I would love for you to take a bit of time to introduce yourself, and then we can dive in.
Thanks so much, Carolyn. It's a pleasure to be here and to be part of this Awareness Week, which is so important because, as everyone knows, that 1 in 6 people will have this experience. And so just want to lead by saying really appreciate the work that you and the whole team is doing to create this awareness across Canada. So it's a pleasure to be here and part of this conversation. So as you've named, I live in Victoria, BC, and the Elements of Health Center is a clinic that I work at as a practitioner of acupuncture and traditional Chinese medicine. I'm also the clinic owner, and I co-facilitate programming with another very wonderful practitioner of Chinese medicine who lives in Edmonton, Alden Yo. We run programming that's online called Mindfulness for Fertility. And the reason that we started offering this programming is because of our decades of experience in practice of supporting people on their reproductive path and journey and through their pregnancy and beyond. And then both of us having a very personal and lived experience of going through fertility challenges of our own, that we really found the support of our mindfulness practice. I've also been practicing lots of years as well. I'll speak to my own practice. Been practicing for 26 years now. And I really felt the support that it was on my path and on my journey in growing our family, that it was something I could really lean on through all the ups and downs and just how tumultuous the journey is. And so that's where we came together with offering programming. The base of the curriculum is through something called mindfulness-based stress reduction. I'm a certified practitioner of that through Brown University, and we're taking that MBSR program and curriculum and guiding it to people who are experiencing the fertility journey so that people can be in community together and learn some tools along the way for how to support well-being. And we do that with formal practices and also informal practices so that it can be really knitted into everyday moments of our life, something that you can carry with you into your day, not just something that happens on a cushion.
Yeah. Amazing. So let's talk about mindfulness and give viewers a better understanding of what it is. I feel like it's a word that we are familiar with, we have heard about. Some people think about it as meditation, but let's talk about it in the context of what we're going to speak about today, to give our viewers sort of that basis point to start from.
Yeah, it is good to define it because, as you said, it's a bit of a buzzword right now. It's kind of everywhere in pop culture, mindful this, mindful that. And so in the context of the programming that we're offering, to take the definition from John Kabat-Zinn, who was the founder of the MBSR program some 40 years ago out of the University of Massachusetts, their medical center. So his working definition of mindfulness is that it's the awareness that arises from paying attention on purpose, in the present moment, and non-judgmentally. And so, that sounds simple enough. Well, of course, we pay attention, in our day, all of us do. But when we start to pay close attention to our attention, we can see that actually it's all over the place. Right? It's bouncing around. It's often moving forward into the future. I find from my work over the last 23 years with patients and then my own experience of it, the fertility journey really pulls us forward into the future. We spend a lot of time there. Right? And then also there's the past where we're recalling and recollecting. So this orientation again and again to the moment that we're in. And this isn't just for the fertility journey. There's a research study that came out recently through Harvard University that shows that the average adult spends 47% of their day not fully in the moment they're in.
Wow.
So we're highly distracted, and I would bet if they did the same study on a fertility population, that they would find it's higher than 47%. I wouldn't doubt it, right? And so this orientation of coming to the present moment is so helpful, because if we're futuring all of the time, what's happening is our nervous system gets revved up and is reacting to the thoughts that we're having. And so that's part of what keeps many of us in a stuck on kind of feeling, right? And revs the engines of anxiety of a nervous system that feels like it's like this all of the time. And also being in the past and the recollecting of what's happened and what hasn't happened and what went wrong. And the fertility journey is often fraught with loss as well. And so that can be part of what's visiting us. So we attend again and again. We recognize what's here, and we attend again and again to this is the moment that we're in now and directly experiencing it. And then we do this through this lens that has this non-judgmental quality to it, this place of softness and gentleness and care. We could really say that this is where the compassion piece comes in. Because of course we have judgments about everything all of the time, but to know that we're seeing things and the impact of our perception on it is hugely powerful, actually. It's hugely powerful. So that's some words about what mindfulness is, and then that sort of leads into a conversation a little bit of, well, what is it not then? Because it's important to name and to be culturally appropriate. That mindfulness and meditation does have roots and a foundation in other religions and cultures and traditions and practices. But the way we are teaching it and the way we're talking about it in our Mindfulness for Fertility program is from this secular lens, so that it is compatible regardless of belief systems or religion that might be practiced. It's this training of attention and this way of being kind with ourselves, of building these heart qualities that are so supportive to our well-being. Yeah.
Amazing. It's just listening to you, I can feel, as we talk about that in a little bit, you have a voice that sort of allows me to be more present. So I can imagine as a practitioner, your patients or your clients are very aware of the work and that you're able to connect with them on different levels.
Mm-hmm. I thread this mindfulness piece into the acupuncture sessions as well. I always joke it's a wonderful opportunity to be present, because you're literally stuck here. And this is my clinic that I'm in. Pin people down. It's like, why not be here? Why not be here fully?
That's
actually.
Right, fully present. What a beautiful connection.
I give people a practice to do while they're resting with the needles, to let the system unwind a bit, and to
Definitely.
really receive and take in the treatment.
I love that. So, how does mindfulness and being present and being on a mindfulness journey, how does that impact, or how can it help someone who is in the midst um, of a fertility journey?
Yeah. Well, what we know from the research, the 40 years of research and development from the MBSR curriculum, because it's evidence-based and has robust research behind it, and really is the pillar and the foundation and the gold standard of all other mindfulness programs that have come forward, is the MBSR program we know can reduce anxiety, can help ease depression, that it supports a sense of overall well-being. It helps with things like insomnia. It also is supportive of people who are experiencing things like chronic pain. And the interesting part with the chronic pain piece, which, the other things I've named, we can also thread into how it could help the fertility journey, right? But if we say the chronic pain piece, what happens with the chronic pain is not that people's pain goes away or that it's necessarily even reduced. They'll still rate their pain scale the same, but their ability to tolerate and be with the pain is different. And their sense of well-being while they're still experiencing a body that's in pain is significantly changed. And so we can see then why that might be supportive for the fertility journey, because we still might be on the path of trying to conceive, and we're going to be having the experiences that we're having. I myself went through surgery, went through a couple rounds of IVF, went through multiple years of trying, right? So the outcome is still the outcome. And yet, how do we build our resiliency around that? And then what we know from the research as well is that 60% of people will drop out of care, even when finances aren't the issue. If it's covered by insurance, which in some provinces we do have some coverage, in BC where I live, we don't, right? But even when finances aren't the barrier, 60% of people will still drop out of care within the first year because of psychological burden, because of the distress of this journey. And so if we can help give people the tools and to build these resources of well-being, then we build the resiliency to be able to tolerate the distress and to be able to keep going on the path. Yeah.
Amazing. And what you're saying makes sense. And of course, it's backed by data. And just in speaking with patients, we
Yes.
know that the psychological burden of this is tremendous.
Huge.
And yeah, and it's so easy. I mean, when I think back to when I was in the midst of my fertility journey, and cycling, and how easy it was for me to consistently try to think about the future. Okay, like what's the next step and the next step and the next step? And how do we just stay in the moment? And I do remember I didn't work with a mindfulness coach, but one of the places that I found I could sort of be in the moment and just sort of be was on the acupuncture table and in my yoga practice. And
Yes.
that was very, it really did ground me in my journey. And it was a
Yes.
huge part of keeping me sane, for lack of a better term.
Yes.
Yeah.
Yes. Part of the Mindfulness for Fertility program, I'll just name what some of the practices are that we do. So there's sitting practice. Maybe we could do a little sampling of it in our time today. That I think would be
Definitely.
nice. I want to just talk about mindfulness because it's not a
No.
cognitive thing, eh? It's
Mhm.
not just something that we think about. It's something that we want to directly experience from the inside. The word we use for this is to embody it, actually. And so we do guided sitting practice. We do something called a body scan where we're attending to the body in a very systematic kind of way, which can be tender to do on a fertility journey, right? Because there's this grief, really,
Mhm.
sometimes anger, frustration, right? Of having a body that's not doing what we want it to do. And so there's this gentle way that we wanna pendulate with that we wanna titrate, that we wanna have a trauma-informed lens with actually, so that we're not overwhelming the system.
Mm.
So we do body scan as well, and then we bring in some movement as well. So we do walking practice, and we do yoga, exactly what you're saying. The yoga is very gentle, mindful movement is kinda more the word we use so that 'cause people have, again, there's perception. How do I feel about yoga? Am I good in it or not, right? Same
Right.
thing with sitting practice. My mind's too busy. I'm not good at meditation. I'm not good at mindfulness. We're not trying to have a blank mind. We're not trying to not think. That's the nature of the mind. That's its job actually, is to think. But knowing that we're thinking is very different than being lost in thought,
Mhm.
right? So when we are aware that we're thinking, there's a bit more space. We're going to have a wider view. We're going to see things with more clarity. We're going to see them as they are. Versus when we're lost in thought, we're kind of, I liken it to being on a thought train. It's just reeling down the tracks and we don't even know that we're on it. And I'll give a lived experience of this for myself. I found out that I had a very low ovarian reserve, that my AMH was not as it should be. The fertility clinic at the time, they've closed now, but it was Victoria Fertility Center. And Dr. Stephen Hudson called me 2 hours before I was about to go on a week-long silent meditation retreat to say, "Steph, I'm sorry, I've got this news about your ovarian reserve." Let's just say it was a rich week of watching the
Wow.
mind, of watching the mind, of watching the heart. I'd be sitting in the meditation hall, I'd be sobbing. I'd like tears streaming down my face, playing out all the scenarios that could be, that would be, you know, all the scenarios. I don't even need to name them. You guys know what I'm talking about, right? And then every once in a while, I would like wake up to the fact, like, and I'd actually open my eyes and I'd look around and I'd be like, oh my goodness, none of that is actually happening. None of it
Mhm.
is happening. And look at the amount of distress that has been created and that I'm suffering with. Like I could see where I was creating very distinctly my own suffering. And so this is the part where mindfulness really comes in, because we can catch ourselves. We can catch ourselves sooner and sooner that we're on a train, and then we can choose to get off the train. We can reorient back to the room like I did with opening my eyes. I watched the trees for a little bit, the way the wind was moving in them, hear the sounds of the birds, feel the support of the chair beneath me, like come into the body and regulate again. So it's really helpful for recognizing our moment-to-moment experience for and how we then accompany ourselves when there's distress that's happening. But I also really like to point out, because there can be, it says it right in the name too, like mindfulness-based stress reduction. Like it's only for when there's stress or stressful moments. And it can be motivating. That's often what brings people to the cushion, is when the waters are turbulent, right? When the ground doesn't feel very stable. But it's also really beautiful to practice in the okay moments too, that what it does is it lights up with a bit more sensitivity the okayness that's here,
Mhm.
maybe even the loveliness that's here, or the beauty that's here, because we're more there for it, as opposed to just being lost in autopilot, moving through our day 47% of the time,
Yeah.
not there for it. And so there's this huge reservoir, actually, of well-being that's available to us in any moment, right in a moment where we're sitting in the waiting room, you know, of our clinic, right in the moment where we're waiting, I'll be graphic, with our legs up in the stirrups, waiting for the, right? Like right in those moments, there can be this way that we anchor
Yeah.
in with ourselves, where we can recognize and look over. I've just done this now. I just recognize, look over, the loveliness. There's a new little plant. I've got a plant just right out off my screen. There's a new shoot that's coming that's looking like it's going to start, curling open, right? There's all these little moments, micro moments, we can call them, that are there and available in our day that are very supportive. And so it helps with both. Like we don't have to get rid of the distress. What we can do is just raise up the
Mm.
quality of the heart that is gentle and kind with itself, right? Bring up the school skills rather, and tools of gratitude, right? If we keep bringing up noticing beauty, do you see what happened? The hard part didn't go away or didn't go down, but now we've got more balance with it.
Mhm.
It's very helpful.
Yeah, and I love that description, because it's not about the distress will be there, this
Yes.
is a challenging journey to be on, and you may be years into this family building, um, experience,
Yeah.
and you're right, the distress will come and go, but if
Mhm.
I've often talked about, in fact, Canadian Fertility Awareness Week last year was finding joy. And I had
Yes.
spoken to, another friend of FMC, who you may know, Dara Roth-Edney. She is a,
Wonderful. Yeah.
reproductive counselor, and she had discussed with us just how finding those moments of joy can help move through a fertility journey. And so I can see why being there to experience these little moments it's like a cumulative effect of,
Totally.
yeah, I think that makes total sense to me, and I'm sure people watching can sort of start to wrap their head around
Yeah.
that as well. And how much are we actually missing? Sometimes you're driving and you think, "Oh my gosh, I'm already home, but I don't remember the last 5 minutes.
Yeah.
What was I doing?" It's kind of that autopilot.
Absolutely. And I do it in the car all the time as an example. I because the mind wanders. It just does. Even with 26 years of practice of doing meditation and mindfulness practice, the mind is coming and going. But how many times in my drive can I know that I'm holding a steering wheel?
Mm,
Can I feel the pressure of my foot on the gas or the brake while I'm brushing my teeth? Am I aware am I aware that that's happening, right? As I'm eating my food, every time I turn the door handle going into the next treatment room. It's a very intentional practice for me. I make sure I know that I'm touching a doorknob.
Mm,
It helps with the transition of then arriving to be with the next person in a way that's very present. And so this is something that you can see how you could bring into your work, you can bring into your relationships. As someone's speaking, this is where we can bring mindfulness really into action with communication. We cover this in week 6 of our Mindfulness for Fertility program. What is it like as we're listening? What is it like as we're speaking? Right? Can we keep some of our presence and our awareness here in the body? Sometimes for some people it's easier while they're listening, but as soon as they speak, it's like, whoa, they feel like
yeah.
mindfulness has left them. And so very, very helpful to again, not just mindfulness for on a cushion in a particular form of the body, but like right in the everyday moments of our lives.
Yeah. So let's switch gears a little bit.
Oh,
Does a mindfulness practice, I'm going to say that mindfulness takes practice. I mean, you've been
absolutely.
doing this for 26 years, and I know that you're continuing to learn now.
Yeah.
Um, can mindfulness help achieve a pregnancy, and how does it help you on your fertility journey?
Yeah.
And is there research that can sort of help support some of these things?
Yes. So we can't say that there's research now that shows that it improves pregnancy rates.
Mm.
That's the golden question that everybody wants to know. If I do this, will it help me become pregnant? And I
Mhm.
just wanna kind of sidebar slightly here, and I'll come
Sure.
back and answer more of your question, but I wanna sidebar slightly here because I just had this conversation with a patient yesterday who is having some distress that she had gone over to Vancouver to have her embryo transfer, and then there was rushing to get to the ferry, and they missed their ferry, and then their mind was looping, transfer. She got there for the transfer, no problem. It was the coming home part, right? So then she's waiting in the ferry terminal, and she was saying to me as she's lying on the table as I'm placing the needle, she says, I find myself fretting that the stress that I just was in, and then she's beating herself up. You can see how that narrative is playing out, right? She's beating herself up, she's questioning herself. I don't know how it is in your minds, but you might recognize it for yourself. This is like this in this one. You might recognize it too, where it says nasty things to itself. Do you guys know what I'm talking about?
Mhm. Defin
Like,
oh, definitely, absolutely, especially
especially in our fertility journey, right? What did I not do enough of? What did I do wrong? Right? And so this one's constantly nagging. So she's describing how she's beating herself up about this and that the stress is maybe going to be the reason why this transfer isn't going to work again because she's had more than one. And I said to her, first of all, just to frame what we know about the research of stress, is that we can say from a large meta-analysis, 44, 100 people, 20 different studies all analyzed, that stress or anxiety or perception of stress does not change the outcome of assisted reproductive
oh,
therapy.
that's so important. So
So
important to know.
important to say that, so important. And often when I say that in class, there's not a dry eye in the room.
Mhm.
People really internalize that it's part of their stress, is part of the problem.
Yeah.
But so we can say that stress doesn't cause infertility, but infertility causes stress.
Mhm.
There comes in that stat of can we stay the course of our treatment, right? So that's the part where we're really interested in, and I've partnered with Dr. Ricky Diane Alda, and I have both partnered with Dr. Ricky Diane. She's doing her fellowship out of McMaster right now. We've partnered with the One Fertility Clinic that is in Ontario. We have a pilot study underway. We've done the first round of it. The second round is about to begin this spring to really look at how does this impact, how does an MBSR curriculum with others who are going through a fertility journey, how does this impact the ability to continue with treatment? We're also, of course, going to measure uh, pregnancy rates because everybody wants to know that as well. And not just at the end of the 8 weeks, but 6 months later, a year later, right? How is that progression unfolding? And so, so far to date, what has been done with research with mind-body programs is they're all different kinds of programs. Right. And so none of them are validated or can be replicated per se. Whereas the MBSR one, we already have 40 years of it. right? We know that if we do this curriculum, regardless of who's teaching it, that it has this outcome. And also what we know, just to say from the neuroscience of what we know about MBSR, is that after 8 weeks of a program, they've done fMRI studies at the beginning, at the end of the 8 weeks, that they can see that there's a thickening of the region in the part of the brain that helps us with self-referential processing, that helps us with these higher executive functionings of knowing of what is right and wrong, how we make choices, what are we deciding, what are we choosing, and that it thickens at the end of 8 weeks. And isn't that amazing that we can change the structure of our brain by doing these practices? And so what it involves is coming to class for 2 hours, 2.5 hours weekly. We've got a day of retreat that we always land on a weekend. All of this is done online on a weekend in the middle of the program to really steep in the practices. And then you kind of pointed this out, Carolyn. I really appreciate that you said this. You have to practice the practice, right? It's not enough to just you get some benefit if you just show up to class, but it's kind of like if I wanted to strengthen this muscle, I can't just read a book about it. I can't just have all the weights sitting down there, ready to go. You have to pick it up, and you have to do it a bunch of times, not just once, but a bunch of times if you want that muscle to be stronger. Same with this muscle here. The more we practice, the more that strengthens the ability and will increase the likelihood that we'll remember again the next time. Because that mindfulness itself is not so tricky. The tricky part is remembering to remember. So the more we practice, the more we're inclined to remember again.
Yeah. And it's almost like creating some habits and some, you're connecting it. I don't know if you've read the book, hold on, I have it right here. The Atomic Habits. Same, like connecting that mindfulness with something else that you do automatically, so it becomes part of the routine. I don't know if that's part.
Yeah, like my steering wheel
That's
example,
right.
Or the door on the handle on the door as I'm going into the living room. And these habits that we're doing, we're either doing them in autopilot or we're doing them with awareness. Because if you think about it, we're always practicing something.
So interesting.
Someone wakes up in the morning and thinks, I'm going to practice being anxious today. I'm going to just, like, in every moment I can, I'm going to really practice hard to be anxious.
No, that's right.
Today I'm going to be as depressed as I possibly can. You don't know. But if we're not paying attention, that is what we're practicing. We're practicing the habit of worrying. We get better at worrying. If we're intentionally practicing the habit of gratitude or compassion or being present, then we're laying down those neural pathways. We're creating new superhighways in the brain. Literally, they get studied by neuroscience of knowing how these neural pathways get laid down, and we can be in the narrative default network of the brain, which is the one when we're lost in thought, or we can be in the direct experience network of the brain, which they can see lights up in fMRI studies when people are attending to practice and when they're lost in thought.
Wow.
It is a habit that is measurable in the brain and that we can practice. We can bring some intentional awareness to our attention, and it's meaningful.
So let's talk about the benefits of mindfulness for someone who is in the midst of a fertility journey, or even maybe, in the preconception stage where they're starting to think even about starting a family, getting pregnant, being pregnant. What are those benefits and how can that impact someone?
Yeah. So it's going to have the support of regulating the nervous system, right? Of finding some stability and anchoring right in the midst of moments that feel rocky. And because of that, it's going to help with soothing and easing of anxiety, the tendency for anxiety to be, and you see this difference I'm going to use in language here, for anxiety to be a visitor as opposed to I'm anxious. You see the difference? It's a nuance in language, but it's quite different, isn't it? Because anxiety, we can see it comes and it goes. And that's part of what mindfulness is doing, is is allowing us to attune more closely and more carefully and more intimately, really, with recognizing the different changing dynamic nature of experience. And so it helps with mood regulation. It helps with sleep. It improves quality of sleep and reduces insomnia. Yeah, the overall sense of well-being, the cultivating of joy, the kindness and the gentleness with how we accompany ourselves, the recognition of that inner narrative that might be going, that's beating ourselves up, and kind of stepping back and just being like, "Whew, that's harsh. It's not just me." Here's three-step compassion awareness practice, is recognizing that suffering is here, right? That some kind of inner narrative is happening, and then bring some kind of gentleness or care. You keep seeing me do this. This is one of the things that like a soothing touch, whether it's to the hand on the chest or whether it's just, I'm bringing my hand up so you can see it, something of some kind of touch. Don't we do that to a friend when someone's suffering? We reach out, we put our hand on them, right? So some kind of soothing and recognition that it's not just me. This is fraught on the fertility journey, is that it is so isolating. It's not commonly dinner conversation, with others. It's why I really appreciate this Awareness Week and all the work that you and others are doing throughout the communities and cities across Canada, throughout this Awareness Week, to let people know that they're not alone through this, so that there can be this shared common humanity experience. The World Health Organization just coming out this month, their report that they haven't done for 10 years, saying 1 in 6 globally, it's 1 in 6. And it doesn't discriminate against countries or social economical status or religion or race or gender expression. 1 in 6 people will have this experience. So just that knowing of it's not just me. Because it's true that when we are in that view of why is this happening to me? What is wrong with me? What am I not doing enough of? There's a real sense that's very painful of feeling broken. Not just me is really healing. And then given that I'm aware of it now, that I can have some kind of, understanding that it's not just me, I'm not alone. Now the third step, how am I going to now attend to this? What's the kindest thing I can do now to be with myself that will be gentle? You see how that interrupts the thought train that we may not even know that we're on. There's me in the meditation story the mind is telling that's not actually happening.
Yeah. And just, I was making notes as you were listing sort of the benefits and how it can help impact. And all of those things, regulating the nervous system, bringing balance back, soothing anxiety. I know any viewer who has gone through this, or anybody who hasn't, this isn't their lived experience, but knows someone who is going through this, a partner who is going through this, that it's written all over people, and it's so heavy. It's part of that, the fear of the unknown. And it sits, certainly for me in my experience, that's where it sat, just this heavy, almost unable to breathe at certain points. So I can see that, bringing a practice in to help regulate those things, bring you back to the present, and not get lost in what if not, those thoughts. And what I love about this is that it's data backed. There is science that shows that this type of practice can be very helpful. It won't be for everybody. Not everybody will want to choose this, just like not everybody will choose to see a naturopathic doctor, or not everybody will choose to further fertility treatment or choose fertility treatment. But to have this option and to know that there is data that says it can be very helpful is such an important piece of information for people and patients to know, so that they can have this as a tool in their toolbox on their journey.
Yes. Yes. I'm excited to be able to share the data shortly, and we've actually applied to see if we'll be able to present some of the early data with a poster presentation at the Canadian Fertility and
Oh,
Andrology Society
so
meeting.
great. That's
That'll be
great,
coming.
and it's great for practitioners and clinicians to see, and to partner with people like you to, um, help guide, as a in concert with, the medical treatment that they're receiving. I think it's a beautiful thing.
And just for
So
practitioners,
oh,
just to say that if there are practitioners listening
mm,
to this, there was a large study that was done that CFAS actually did a webinar presentation about that I listened to. The study was in 2021, where they looked at it was a multi-center
yes.
study, 9 countries, right?
Yes.
And it showed that part of what the study was about is what are the barriers to receiving care. And one of the things that they found was the retention
Mhm.
of people was one of the barriers, to creating a family. And they said that approximately 60% of people would stay the course of their treatment if their fertility doctor in first consult acknowledged the distress and said, here are some resources to support your well-being because we know this is hard. Whether people actually access them or not didn't matter. Just the fact that the doctor acknowledged it and named it, and here are some resources, versus if they only gave the medical plan,
Mhm.
then 30% of people would stay the course. That's huge.
That's
That's
huge.
huge to be able to address the whole person, not just the fertility journey, the whole person, patient-centered care. And I feel really excited that there's more and more clinics and there's more and more healthcare practitioners just in general, regardless of whether it's the nursing team or the embryologists or the doctors or the naturopaths or the meditation people or whoever it is, that there is this more holistic view that's starting to form of how do we support people? How do
Yeah.
we support their well-being through the journey? And then I care about this a lot too, and of course lots of others do as well, but you get pregnant and then what?
Right.
All this anxiety, all of this depression, all of this worry, it doesn't necessarily end once you
Mhm.
get a positive pregnancy test. And so how do we these tools, how does it support the well-being through the pregnancy? How does that impact postpartum? How does that impact parenting?
Yeah.
I know we're on a fertility journey, the view is still narrow like this, let me get pregnant.
Yeah.
But there's a study that just came out that was just announced 2 months ago that for the first time has looked at an 8-year gap of following people who are pregnant that were high risk, that had low social economical status, that were high risk people. They gave them an 8-week curriculum, which was the MBSR curriculum, modified slightly. They then had 2 postpartum visits, and they then followed them 8 years later. What they found was the people who did the 8-week program and had those 2 visits postpartum, 50% reduction in depression 8 years later.
Wow.
That's amazing, right? And so we know
Wow.
that I think it's reasonable to put people who are on a fertility journey and have reproductive trauma
Oh,
in
yes.
the category of high risk for anxiety and depression carrying forward into pregnancy. And how does that impact the family system down the road?
Mhm.
Because we know that it does,
It
right? And
definitely
so,
does.
like, let's look upstream. How do we support
Yeah.
people with tools when we know there's distress, right?
Absolutely. It's interesting we're talking about this because certainly from a personal perspective, when I went through my fertility journey, when I started 10-ish years ago, I didn't know about these things, and mental health and that type of support was not, um, talked about, really offered, to me from my clinic. And now on the other side, and in fact, this week alone, I've recorded with a few other professionals who have all talked about the PTSD and trauma that some people experience from the journey and how that impacts going forward. And now my
Yes.
eldest is 9. I look back and think, wow, that likely was me. That trauma from my fertility journey, and mine was very straightforward considering,
Yeah.
all of the stories that I am very privileged to know. Um, but I am only now in the last probably 4 to 6 months realizing that that's probably part of my story, and I wish I had the tools in place like this
Yes.
back when I was in the midst of it, and I just didn't know any better, and
Mm.
that's why the part of the mission of FMC is to ensure that people know these things exist and that
Yeah.
they can pull from the toolbox what makes most sense for them.
Yes. And this trauma piece that you're talking about is so important because there's there's so many different ways that people are on the journey, but I'll just speak to the part where people experience loss on
Mhm.
top of the trying to conceive. I had somebody in my class that just closed. I have another series of classes that I offer through. There's a collaborative group of us called West Coast Perinatal Care that just operates in Victoria. I run some mindfulness programming for people who have experienced loss. And then when they do become pregnant again, 2 separate classes. You can imagine that needs to be 2 separate classes. But one person in my class that just closed a 6-week series last set, she named and said, um, she said it like this when we were working on body scan, very short one, 5 minutes, just attending to the body. She said, "It's so hard for me to be here with my body because my body feels like a graveyard."
Mm,
She'd had 5 losses. And so, of course, there's gonna be trauma that reverberates from that, right?
yeah.
And every time she goes to have another procedure, it's almost like a re-traumatization every time she's back in that clinic again, every time she's back having herself up in those stirrups we just talked
Oh,
about again.
yeah. Gosh.
She's working really hard, and she's working with a therapist as well, right?
Yeah.
And just to say that it's not mindfulness or counseling, that
No.
the counselors that I work really closely with, they really love the mindfulness actually, because the mindfulness helps to build this capacity with the awareness so that you can do some of the deeper work, right?
Yeah,
With
absolutely.
counseling. They work really beautifully together actually.
Mhm.
Yeah.
Wonderful.
Mhm.
So, Steph, how do people, we've now had this really beautiful conversation. For
Mhm.
viewers who are interested in um, building a practice or getting involved, what are some resources? And I'd love for you to talk a little bit about your program specifically, um, and then let people know how they can connect with you if they were interested in learning more about the program.
Yeah. So, just to say some general resources first, and ones that could be accessible to anyone to try out, is there are certainly a number of apps that are available. General ones like Insight Timer or Calm app or 10% Happier, Waking Up app. There's a number of ones that are out there that will have this secular lens that don't have a religious component to it, because of course there's those ones as well.
Mhm.
Um, uh, so those could be helpful and supportive. There are a couple that are fertility related. There's Expectful or Circle and
Mhm.
Bloom. I know there's one called Ferticom. That's another option. Um, then there are certainly books. There's a number of books that are available. Doing a Google search on that would be helpful. On my website, elementscenter.ca, under mindfulness, there's a resources thing. I list kind of all my favorite books and apps and websites and things like that, places to practice. Generally, you could sign up for, if you wanted to be in person, you could sign up for an MBSR, mindfulness-based stress reduction class. It'd be a general cohort. People could be there for all kinds of reasons. If you didn't want to self-identify that you were on a fertility journey, that is a possibility or available. Certainly those classes are available on Zoom as well. Lots of people offering them because of the pandemic now, on Zoom. If you did want to be in a group with others who just know, this lived experience, and to be guided by teachers like Alda and myself who just know this journey from having lived it too. Right? I myself, 26 years into my practice, I have a teacher. I have a few teachers actually that I go and sit with and I go and be on retreat with. Still to this day, it's so nourishing. It's so helpful to have a teacher, to have guidance, to be able to bounce things off of. And so the being in community part is such a big part. We always check in with people halfway, and then at the end, a little bit of feedback. How does it go? We're going to have the data to actually, support this. And I'll have, next time I speak, hopefully there'll be like graphs and, percentages and things that I can share. But what I can say anecdotally from the 2.5 years we've been doing it with the Fertility Foundation is that people are constantly saying how healing it is to be with others. That's one of the main things they've gotten as a takeaway. And then people stay in touch together after the 8 weeks are over, you know? So if you wanted to find out more about the programming, it's mindfulnessforfertility.com. The next class series is starting during the Fertility Awareness Week. Actually, it's going to be on the Friday. It's from 3 to 5 p.m. if you're on the West Coast, Eastern Standard Time for folks in Ontario. It'll start at 6 o'clock. It'll be from 6 to 8 on Fridays. The details for all of that, you can see our Instagram page at Mindfulness for Fertility, or go to our website, mindfulnessforfertility.com. Just to say as well that we offer all of our programming by sliding scale. We just really have this very deep, heartfelt connection that anyone who feels called to practice, we don't want finances to be a barrier. We do name what a sustaining rate is. Like, if you do have funds available, this is what we would, charge. But then there's scholarship options. And then there's also, if you'd like to support, knowing that others are utilizing a scholarship, so that we just make room for everyone. And that's offered at the end of the program. There's just like a deposit that's paid, and then you offer at the end once you've have a lived experience of going through it. And then it's not like a fee that you're paying. It's more like, let me support the teachers such that they can keep offering it in this way. And it's very sweet. I've offered, I don't know, 50, coming up maybe 60 programs like this in different ways, whether it's through loss, whether it's through postpartum, whether it's with educators, whether it's with this fertility work that we're doing. I offer all of the programming in this way. And it's very beautiful. And I appreciate people's generosity in saying generosity, right? And that's one of these heartful, uplifting things that we can cultivate that creates this sense of well-being, actually, is where are the places in our life where we can be generous? And how does it feel for this one? How does it feel for this one? As they're receiving, it makes this beautiful feedback loop, actually. So there's another, whether you practice mindfulness or not, that you could bring into your everyday life of how can I be generous? How can I meet someone and look them in the eyes and smile? How do I hold the door open for somebody? Like, again, little micro moments in our day that we can be there for, we can be aware of, we can feel nourished by.
Yeah, it's really awesome. Steph, thank you so much. I hope that's okay. I'm calling you Steph in a more professional setting, so I apologize.
Please.
Um,
One more thing,
yes.
because I feel us wrapping up, and the one other resource that I wanted to name is on our Mindfulness for Fertility. If you go to Instagram and you go to our link in the bio, it'll take you to downloading a free mindfulness app, mindfulness practice, rather, not app, mindfulness practice. So there's a 10-minute anchoring practice that you can download or stream, and we'd love to have you sign up and be able to utilize that for your well-being. And so I wanted to make that available to everyone as well.
Thank
and
you.
perhaps that could be something we have linked. I can share the links and access as well,
And
with ease.
I've downloaded it and used it, and it's lovely. So I appreciate you and Alda making that available for people. To our viewers, please connect with the team at Mindfulness for Fertility. Download that beautiful mindfulness document practice. Thank you. Yes, and if people are interested, remind me again. Are they still able to sign up for your session that's starting this Friday, or will you have another session that people will be able to connect to?
The session that starts this Friday is the first session. It's an orientation, and then the class actually gets started, class 1, on that following Friday. So if somehow they miss this and don't hear it and have missed the orientation, please email us. We can find a way to give you your own mini orientation so that you're ready to join us on the Friday.
Oh, so great.
I believe it's the 5th, so that you could join us for class 1. But then once we get started, that you commit to the 8 weeks, and it's not a come and go kind of thing. You could let us know, and we could let you know when the next class is being offered.
Wonderful. Yes. Stephanie, thank you so much for being here, for you and the team at Mindfulness for Fertility, and of course, your team at Elements of Health. We appreciate you. Thank you for all you do for your patients, both in Victoria and your broader patient base in Canada. This is Canadian Fertility Awareness Week, where we are redefining infertility. Don't forget, Fertility Matters Canada is a registered Canadian charity. And if you have the ability to donate to our cause, you can find out how to do that on our website, fertilitymatters.ca. Thank you for being here. We hope you have enjoyed this session of Figuring Out Fertility.
Thank you, everyone.